Topic 10. IBD versus IBS. What are IBD and IBS? Inflammatory bowel disease, also known as IBD, is characterized as an autoimmune disease that involves inflammation in the intestines, persisting in the gastrointestinal tract, which commonly damages the lining of intestines, resulting in digestive challenges. IBD is frequently associated with two types of idiopathic intestinal disease, ulcerative colitis and Crohn's disease. With many physical symptoms present and displayed, this requires long-term treatment to manage inflammation to limit and avoid infection. Irritable bowel syndrome, also known as IBS, is characterized to be a functional gastrointestinal disorder, which is a condition that affects stomach and intestines without inflammation or visible structural damage. IBS disrupts communication signals between the brain and the gut and causes visceral hypersensitivity. For the complexity and diversity of IBS presentation, finding a suitable cause and treatment is difficult, and the pathophysiology is unclear. Thus, being able to understand the brain-gut axis can we provide long-term treatment and support to those suffering from IBS as well. Although both IBD and IBS have no single cause, there are contributing factors that link to the cause. IBD is multifactorial, as it involves a combination of genetic and environmental factors that may lead to imbalance of intestinal bacteria, leading to inflammation in the gut. A genetic factor includes having a strong family link, where having a relative who has IBD increases the risk of having IBD themselves. Environmental factors include diet, infection, and smoking. On the other hand, IBS is developed through a combination of gut-brain miscommunication, sensitivity, and external triggers unrelated to structural damage. Gasiness, irregular colon motility patterns, and changes in chemical levels within the gut microbiome can potentially cause IBS. Symptoms can vary significantly between individuals and may fluctuate over time. Both IBD and IBS share several common symptoms presented in the accompanying table. However, IBS is more commonly associated with bloating, excess gas, constipation, as well as sensation of incomplete bowel emptying. In contrast, IBD can be differentiated by more severe and systematic manifestations, which include anemia, rectal bleeding, chronic fatigue, etc. Additional symptoms may involve skin inflammation and loss of appetite, which reflects the inflammatory and autoimmune nature of the disease. Unlike IBD, IBS often presents intermittent and symptom-free periods, and due to no visible intestinal damage, it is difficult to diagnose accurately. Both IBS and IBD have similar methods to diagnose an individual, like blood tests, stool tests, and endoscopy tests, but the type of results differ from each other. When diagnosing IBD, methods such as blood tests, fecal calprotectin test, and colonoscopy tests are all used to determine inflammation and anemia, measure the levels of fecal calprotectin found, and check for signs of inflammation in digestive tracts, respectively. In contrast, diagnosing IBS is more complex because no visible inflammation, or structural damage can be found. Thus, similar tests used to identify IBD may be conducted to rule out other conditions and symptoms to determine whether it is IBD or IBS. This mainly relies on evaluating symptoms and identifying patterns, which is often supported by dietary trials to observe how food can affect symptoms. With limited treatment, IBD involves prescribed medication that aims to reduce inflammation within the gut, while in contrast, IBS specifically targets and manages visible symptoms. Since both IBD and IBS have similar symptoms in both conditions, similar medications can be taken, which are listed on the bottom. This can be followed up with dietary lifestyles and modifications to improve overall IBS symptoms control and management. Supported by previous slides, these 6 recommendations are suggested by health professionals and me regarding IBS and IBD. By maintaining a healthy diet, exercising regularly, getting enough sleep, undergoing regular and consistent medical checkups, managing stress, and remaining informed about IBD and IBS by engaging with credible sources, you can support yourself and others while within the community. This is my use of AI and references. Thank you.